brachytherapy is a form of radiation therapy in which a radiation source is placed in close proximity to an area requiring treatment. In recent years, it's been demonstrated to be an effective therapeutic solution for both low and intermediate risk prostate cancer. And in contrast to other types of radiation therapy, brachytherapy is able to deliver a high dose of radiation to the prostate gland while relatively sparing the adjacent organs and tissues from radiation. However, due to the anatomic proximity, the bladder, the anal canal, and the rectum still remains at risk for radiation exposure even with brachytherapy. And theoretically, these organs are also at risk for developing subsequent secondary malignancies. And our research really is to categorize the clinical course and prognosis of secondary bladder malignancies associated with prostate brachytherapy and compare these characteristics to historic control data from the National Cancer Institute database for bladder cancers. And in a quick summary, overall, we had 50 patients who met our inclusion criteria. Almost all tumors in our data spared the anterior bladder wall, possibly suggesting an etiology of prostate radiation-induced secondary bladder cancer. And bladder cancer in our study demonstrated a significant increase in the proportion of high-grade tumors in comparison to historic controls. Our secondary bladder cancers had 80% of our tumors were high-grade versus 50% of historic control tumors were high-grade. And although not statistically significant, there was a high proportion of bladder cancer secondary to brachytherapy that presented with muscle invasion as compared to historic controls. And despite these presentation with higher grade and later stage in comparison to historic controls, these secondary bladder cancers actually had comparable 5-year survival and 5-year